every day we talk about infections, and every day infections are actually diagnosed. Every day people come down with infections and die from them. They're very serious, and today we're going to go over these questions. What type of infections? We're going to learn all about that. What are the symptoms? We're also going to go over that. And what are the risks, the complications? Let's move on to bacterial. Bacterial is bacteria that can get inside any cracks or skins or anything and can kill. So we are going to be talking about what is meningitis. So I will pick from each category: viral, fungal, and bacterial. This is bacterial, so this is one that is a bacterial infection known as meningitis. Now this can be caused by a whole bunch of types, but this is the one we choose for bacterial, which means you will not be choosing this for viral or fungal. Usually it's never is viral or fungal, it usually is bacterial, but there are some cases where there is fungal or viral. Of course there's actually viral meningitis. Viral meningitis is a real thing. So let's go over everything you should know. What is this? It's an infection of the meninges, protective tissue of the brain, that causes stiff neck, headache, and fever. So one way you can test for it at home, you can't self-diagnose yourself with it, but you can test yourself, is put your head up, down, left, right, whichever way is left and right, I don't even know, but turn your neck, and if you can do that, that means you don't have it. That's one way of knowing. Now that doesn't always mean the right thing, but for me, when I have health anxiety and I think I have it, me doing that makes me think, okay, I don't. And trust me, when you know you have meningitis, you will know, because it's like the worst pain of your life, okay? Although I've never had it, I can just tell you, it's a brain infection. It's gonna kill you. It's gonna hurt. So yeah, you need to get treatment for it immediately, because if you don't, I don't feel like people understand the dangers. The dangers of having meningitis is super, 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 super high. The dangers are forgetting your memory, never being able to walk, having to be taught all the stuff you know how to do: count, walk, read, math, like everything you've ever learned in your life. Even if you're a football player, you can still come down with this. Just because you're a football player, it doesn't mean you're not vulnerable to diseases. But you can forget everything you've ever learned in your life. You literally, with this, and there's a possibility where maybe you might get the treatment you need. And I'm not going to say you won't get. I'm saying, even though you get it, you're going to have to be taught the same stuff that you've been taught before, because if it gets so bad, it might actually cause you to forget how to do things that you knew how to do from day one. And when that happens, you'll know. You'll never, ever be the same again. Even when you're back to your full self, you're really not, because you're probably, I don't even know how you could have PTSD from it, to be honest, because maybe actually there might be some people out there that they actually know they're going through this, and they actually keep their memory of it, which can bring back bad memories to them later on in their life. But when you have meningitis, it's kind of rare for you to actually, I think, remember, in my opinion, because when you think about it, meningitis, your memory's bad. All right, it can really cause memory loss, and the loss of ability to do things, which means the doctors at the hospital will have to teach you how to walk, poop, eat, pee, get in bed, go to sleep. Well, teach you all of that stuff, like you are a new baby, but in a grown man's body. All right, you will basically be a baby again. All right, you'll basically, first off, you might never know your family again, so you might have to be taught, your family and all that stuff. You might never be the same again with this. It can be that serious and life-threatening, because you'll have to be taught all the things you knew in your life all over again. And it's not a fun sight. Symptoms. This is where it gets interesting, alright? If you or someone you know is exhibiting symptoms of meningitis, seek medical attention immediately. Meningitis symptoms include sudden onset of fever. So if you have like a fever, like 1 second you don't have a fever, like one day, and the next you do, with a stiff neck, that's most likely and a headache, that's going to include meningitis symptoms. Now those three are basically the top 3 symptoms you needed to look out for someone that has this You need to look out for those 3 symptoms. If they have all 3 of those symptoms together, chances are they need the attention that they need immediately. Because if they don't get it, there's a possibility they may never survive and they will die from this. And that's not a joke. You will die from meningitis. It's not something that ain't to joke about. It's not something to, it ain't something to joke about. It's definitely not something that can be taken lightly because, again, you will know it when you have it. It is the most painfulest thing you're probably going to experience. Maybe, in my opinion, I might get a lot of hate for this. Maybe a lot of, bull crap. But, it might actually hurt more than a heart attack because a heart attack is a quick killer like that. But meningitis, on the other hand, you're going to go through that until they can come up with a treatment for you. All right? There's different type of antibiotics or medicine that will help you get rid of this. But it all depends on how bad it is, depends on your body, depends if you have an allergic reaction to it. If you do, then that delays you from actually getting the medication that you need that won't end up killing you from an anaphylactic shock. And it is true. Some people actually had allergic reactions to medications. All right? But if that's the case, then your treatment will be further delayed until they can figure out one that they can give to you, which they won't have to worry about you having an allergic reaction again. But again, if you find one, it's gonna take some time for it to work. It's not gonna be like an automatic. Okay, I'm gonna be fine. I'm gonna go home and play football or Fortnite or something. It's not like that. All right, meningitis is something you should never ever joke about. And if someone jokes about it, ignore them. Okay, because this stuff is really serious. Let's move on. We have headache with nausea or vomiting, which could be a migraine. So not always. So if you just have a headache with vomiting and nausea and you're watching this, don't think, it's something serious. And you might be asking, why did I put that disclaimer at the beginning? Well, some people actually are like me, and they want to actually learn more about this stuff and see if they actually have it. Now, I am someone who does medical research. I am fascinated with medical topics. I want to be a medical doctor when I go older. Therefore, I'm actually enjoying making these. But no, I am not a professional. So if you want someone that actually knows what they're talking about and doesn't take it off of Google, then don't watch this video because I'm not that person. I'm not an actual doctor. A 14-year-old kid cannot get a medical license. Definitely not somebody like me. So don't take this video with literal evidence, because although Google probably never lies with their medical stuff, it's still not something you want to, I have this. No. Chances are it's probably not that. First of all, we have a stiff neck. It's probably just because you laid on it wrong. Trust me, I've learned that the hard way. Anyways, decreased appetite, which means you're not going to be very hungry. Confusion, which means you forget things easily. It means you're not in your right state. You're not actually how you are. If you're someone that forgets things usually, then that's going to be kind of hard to tell from meningitis forgetfulness or forgetfulness just because you forget things. But confusion or difficulty concentrating, you might not be able to concentrate usually because you're in pain with this. We all know that. Sudden fever, so you're going to have a sudden fever. Like we said at the beginning, severe headache that seems different than normal. Severe headache that seems different than normal. Seizures, sensitivity to light, sleepiness, lethargy, and skin rash. So if you have a skin rash, usually that will appear with you when you have meningitis. So that's not always the case, but if there is a skin rash with all these other symptoms occurring, then most likely it will be meningitis. Now this symptom right along isn't going to be the big hitter for, I have meningitis. It's going to be stiff neck, headache, and fever, and seizures. Those are the 4 symptoms you need to look out for. If you think someone has meningitis, look for those 4 symptoms. Again, stiff neck, headache, fever, and seizures. Those all 4 symptoms, let alone just those 3, fever, headache, and stiff neck, are all signs that you should get help immediately, because again, anything is possible, so you don't want to miss the chance of fixing something that could destroy your life forever. Causes is meningitis most commonly by bacterial or viral infection. Viral meningitis is caused by enterovirus, classes virus, Coxsackie viruses, echoviruses. Viruses which cause meningitis include West Nile, influenza, which is the flu, HIV, herpes virus, etc. Most viral meningitis resolves without specific treatment. So most likely viral meningitis would be your best shot of making it out alive and not having your brain fried like a pan. But bacterial meningitis is caused by a bacterial infection. The contagious and deadly most common type of bacterial species that causes meningitis are Neisseria virus. I don't even know how you pronounce that. Causes meningococcal meningitis, Listeria, Haemophilus or something. I don't even know how you pronounce these words. Another type of influenza. Meningitis can spread through coughing, sneezing, sharing utensils. Can be prevented by covering mouth while coughing, sneezing, and sneezing, of course. Avoiding contact with sick people, particularly if you have an immune problem. So we see like chemotherapy. Chemotherapy, it's a good way of treating cancer, but it's a good way of killing you. I'm not saying don't get chemotherapy, but in the way the world is looking, where sepsis is now a common thing to get, and where all these other things are happening, chemotherapy is one of the worst things you could get to treat cancer, mainly in my opinion because it weakens your immune system. Maybe beats your cancer a little bit, but you want to live, right? You don't want to end up with cancer and have meningitis just because you have chemotherapy. Like, I feel like chemotherapy should have more ups than it does, but no, it has more downs. Of course, you could end up with sepsis faster than anyone else that isn't on chemotherapy. You could end up with meningitis before anybody else does because that weakens your immune system. Because your immune system gets weakened with antibiotics such as chemotherapy. That is a drug that helps beat cancer, but again, that also beats up your immune system. So that means that your immune system isn't going to be its best at fighting back viruses that could end up being meningitis. So you got to be careful with what type of stuff you want to use to beat cancer and have not meningitis at the same time. So the age factors include age is children below 5 years old, pregnancy, weakened immune system, and skipping vaccines. So let's talk about what is the Coxsackie viruses. So these we're going to get into a later video, not now because it is kind of a confusing topic. It's type A viruses cause herpicania, or however you pronounce that, sores in the throat. That's what it's actually known for. And hand, foot, and mouth disease. So that's what Coxsackie virus type A viruses cause hand, foot, mouth disease, and sores in the throat. Type B viruses can cause epidemic, pleurodemia, and inflammation in the chest. Excuse me. Complications include brain damage, seizure, hearing loss, buildup of fluid between the brain and skull, which I think is cerebrospinal fluid, and probably could also conclude to where you're basically gonna die, and that can actually also not only be that, can also mean that your cerebrospinal fluid is increasing and your brain pressure is increasing. So your brain pressure is going to increase, and that's basically what buildup of fluid is. Because if they see buildup of fluid, that's a very dangerous scene that can cause very serious symptoms and can kill quick. Learning disabilities, so you might not be able to learn as good as you could before. And if you have a learning disability already and come down with this, there's a chance you may never be able to learn like anybody else before. And loss of memory. So you might lose your memory of the time that you'll probably lose your memory mainly just because basically this affects the brain. So it can basically kill the brain's memory source or the memory space. So that means that once that's killed, you won't remember anything. Mainly, I think that could happen probably when you're actually like unconsciousness. Even when you think about it, meningitis is in the brain, so chances are you might forget your memory 100% of the time, because maybe, I think, in my opinion, you might lose your memory of just the event of meningitis happening, or you might lose it of your entire family, because again, it's affecting the brain, and the brain is what keeps the memories in place, keeps the memories you think of, keeps the names that you remember, the names you know, the people you know, the things you've been at, and that keeps them all safe. It keeps them right here in your brain, is all of your memories. And if it affects the place where the memories come from, where the memories are stored, then it might kill you. Because again, any part of the brain that's damaged can lead to death, but you need quick treatment for anything to actually not kill you. So thank you for watching this part. Let's move on to the next part. Viral infections. Alright, so our next one, this one is going to be for our viral infection one. We're going to be doing what is the flu. Now the flu is one of the most, and if not the most interesting ones to talk about for the viral. Of course, we're not going to put a cold on here, although it can cause serious things that will probably shock everybody. It's not something I want to do it on because, again, there's possibility of it actually leading to it, which I'm not trying to jinx it because I'm having a cold now, so I'm not trying to catch meningitis or sepsis or the flu or anything like that. I don't want sepsis. I don't want meningitis. I'm not joking about that stuff. I know how bad that stuff is. Me just doing research on this type of stuff freaks me out about catching this type of stuff. I don't want the flu. I don't want, freaking meningitis. I don't want the sepsis. I don't want that stuff. If you guys want it, well, I'm sad because out of this video, this guy should tell you not to want this stuff. So we're going to be talking about what is the flu, and it's basically serious, and here's why. It is serious, and we're going to go over it so you guys can know, and maybe shock your friends that you know all the information that I do. Okay. What is the flu? A disease caused by virus infecting the respiratory tract. So the respiratory tract is kind of part of like your upper chest area, like your lungs and all that. It kind of affects that, and it can affect the stomach as well because it makes you vomit and throw up. So the difference between a cold is the symptoms are actually less severe and more milder than the flu. The only reason you guys are so miserable with a cold as well as the flu is because your body is fighting an infection off, and because you basically are you're sniffling, you're coughing, you're sneezing, you're all that stuff. And that stuff is very, very, very annoying and very, very exhausting. And it's very, not painful, but it just, it makes you miserable because you're tired, you're hot, and you're cold for 1 second, and you're hot, and you're cold again, then you're sneezing, then you're coughing, then you can't smell, you can't taste your grandma's food. So yeah, it's pretty bad. So, the symptoms are, if you're experiencing new, severe, or persistent symptoms, contact the healthcare providers, because then they can give you the information you need to maybe beat this thing. Any symptoms include fever, malaise, headache, runny nose, sneezing, reduced sense of smell, metallic taste in mouth, chills, cough, body ache or muscle pain, and of course sore throat. Now these are not all the symptoms. They needed to include vomiting, diarrhea, and nausea. Those are the 3 symptoms you can actually cross off with a cold so you can tell which is which. A cold, you're not vomiting, not nauseous, not diarrhea, but with the flu, you have diarrhea, you're nauseous, you're vomiting. All 3 of those are the difference between the cold and the flu. Now again, although the flu may have complications that are so deadly that it might shock you, it's not more deadly than catching, you guys all know what we're talking about, right? COVID-19. It's not as bad as that. Now, saying you had a weakened immune system with the flu, but someone with a strong immune system with the COVID-19, that's a different story, because a weakened immune system that's weaker than somebody else's immune system can kill somebody, okay? If your immune system is weak, it allows more bacteria to actually fight and actually win. So maybe there's sometimes where by luck that a weakened immune system actually wins against a strong bacteria infection. But most cases are, if you don't have a strong immune system, it will win. The virus, the bacteria, the infection will win, and it will spread to different parts of the body, leading to amputation, sepsis, meningitis, or much worse, death. Now, there are different types of parts of the bodies that, bacteria or infections might want to spread to. So it all depends. Some bacteria will actually like to spread to the kidneys and might end up. Now it all depends where the infection will go. Once the infection enters the bloodstream, it's anyone's guess. It might affect the brain. It might travel the whole way up from the bloodstream into the brain, affecting the brain, causes meningitis or encephalitis, which are two brain infections or inflammation. Or two, it will spread to the kidneys, causing kidney failure, kidney damage, and much more. Or it could spread to a bunch of organs, causing sepsis, and then, unfortunately, septic shock, and then, unfortunately, after that, death. So, yeah, so there's different parts of the body that it would want to attack. Now, it all depends. If it wants to attack the kidneys, it might go for that. In my opinion, I think it just chooses where it wants to go. Of course, that may not be the truth, but in my opinion, I think it chooses. It wants the kidneys, it'll go for the kidneys. If it wants the stomach, it'll go for the stomach. And if it wants the brain, it will go for the brain. Now, the brain is the biggest part of our body. It's the home. It's the center of our body. It's what keeps the memories inside and a whole bunch of stuff like we talked about in the last part of this video. This video is going to be a pretty long video, 20, 30, 40 minutes long, so I hope you enjoy. But it can be very fatal. Trust me. It just depends on where it wants to spread and how dangerous it will be if it does spread. I mean, most likely any disease that will spread to the bloodstream will kill you if you don't get treatment or realize it immediately. So yeah, it will be fatal, 100%, no joke. Let's move on. Causes. The flu is caused by viruses of class A, B, and C. Flu spreads directly or indirect from airborne droplets produced during sneezing or coughing. Elderly people of the age of 65 years are at a higher risk of infection. The others include adults suffering from respiratory problems such as asthma, chronic obstructive pulmonary disease, with chronic medical conditions such as diabetes, cancer, with poor immune system. So again, the one to blame for this is going to be chemotherapy. We all know chemotherapy is what treats cancer, but kills you from other things. Now, the chances are, it might not. I'm not going to spread rumors saying, okay, you're clear, after all the hate I've put towards chemotherapy. I've never had cancer, and I pray to God I don't get it. That stuff is not to joke about. I hope everybody that has it that I know will survive it, will overcome it, surpass it, and forget about it. So yeah, it's just a really bad thing. Moving on, the complications are sinus infection, pneumonia, which is a lung infection, ear infection, which if that actually spreads, hell, that can cause meningitis, myocarditis, which is like a heart condition, and again, one of the brain conditions we just talked about, encephalitis. The one and only encephalitis that I know somebody that has it. I'm not going to say who, but I know some people that actually came down with encephalitis. This too, and kidney failure, because again, it can spread to the kidneys and will cause kidney failure. So chances are, you may not survive, but it all depends on your immune system and how it responds. So let's move on to the final one, fungal. Fungal infection. Okay, so right now, for our fungal infection, we are going to be talking about what is valley fever. So I've never really paid attention much to valley fever. I've heard of it, but I've never paid attention to it, as much as I do this. So let's just get into the, slideshow of valley fever. This is the one we chose for fungal. So we went through bacterial, viral, and now we're in fungal infection. So let's begin. What is valley fever? Valley fever, a fungal infection caused due to fungus osteotosis, something that gets into the body through inhalation. Inhaling. Basically, if you inhale, it gets through the inhalation of the fungus. If you breathe in this specific, fungus, it basically will cause valley fever. That's basically what causes this. Symptoms are: if you're experiencing new severe or persistent symptoms, contact a healthcare provider. The symptoms include fever, cough, chest pain, cold, rashes, night sweats, weakness and fatigue, joint aches, headache. If conditioning gets worse, symptoms may increase too. Now these are the worst ones we could possibly have. It's actually pretty shocking to me of all these symptoms, plus the if conditions get severe is low-grade fever, weight loss, blood-tinged sputum, nodules in lungs, ulcers and skin lesions, painful and swollen joints, and meningitis. So again, most of these will either have symptoms of meningitis or will actually have a complication of meningitis. Here we actually have it as a symptom. So that is something new that I didn't think we would ever run into in today's video, is having a symptom of a condition that is meningitis. But again, we do. So like meningitis for a symptom is pretty bad, because again the complications are even worse. Causes are: breathing in the constative fungus is the sole reason for occurrence of valley fever. The risk factors include aging, environmental exposure, people living in areas where the fungi are common at higher risk, pregnancy, and weakened immune system. Like I said, chemotherapy is the killer. This is exactly why chemotherapy is a killer, because that weakens the immune system, which then opens up your body to more infections. So this is one of the ones that you can end up getting just by having a weakened immune system. So yeah, it's not one you want to have. And diabetes. The complications are severe pneumonia. If an infection persists, for a long period of time, it may cause severe pneumonia, which ammonia let along is a pretty bad infection as well, a pretty bad medical condition, and a ruptured lung nodules. So basically a part of your lungs will rupture, and that's bad because the lungs is what makes you be able to breathe in oxygen and breathe. Without that, you might go into hypoxia and you might die, definitely from some type of shock. Spreading of infection to other parts, leading to spinal, brain, or skin infection. So mainly this will mean brain infection like encephalitis, brain infection, a spinal infection, and much more. Now usually meningitis is kind of like a spinal and brain infection at the same time. That's kind of why you cannot put your head up and down, is because your spine is connected to your neck. So being able to do this, that basically will tell you if you have meningitis at home, is if you can put your head up and down and, both sides, that means you don't have it, because you wouldn't be able to do that with meningitis. So thank you for watching today's part of today's video. We're going to get to the final part, which is only going to be 3 more minutes. See you guys.